This episode is the first in a series on physician advocacy. Today, you'll learn how to better understand private equity-backed corporate medical groups and their effects on the workplace, how to explore collective bargaining as a physician. We'll help dispel some myths about unionization and help empower you as a physician to be able to make meaningful change in your workplace.
Welcome to EM Pulse, bringing research and expert opinion to the bedside.
We're your hosts, Sarah Medeiros
and Julia Magana.
Welcome back to EM Pulse. Many of us go into medicine because we want to help people. We dedicate years of our lives to training, learning how to heal, and preparing to care for patients in their most vulnerable moments. But too often, the system we work in makes it truly difficult to provide the care our patients deserve, whether it's broken policies, systemic inequities, or corporate interests prioritizing profits over patients. These challenges can feel overwhelming, and for many of us, the realities of working day-to-day in this system, the long hours, the moral distress, and barriers to care, can drive us to burnout.
That's why advocacy matters. Because at its heart, advocacy is about justice. It's about making sure that our patients, our colleagues, and our communities have access to the care and support they need. It's also about finding ways to work together, to build coalitions, bridge divides, and find common ground, because that's how we become successful agents of change. I'm Dr. Anna Yap, your guest host for the special EM Pulse mini-series on advocacy in medicine. I'm an assistant professor of emergency medicine at UC Davis and the Health Policy and Administration Fellowship Program Director. My goal for this series is to show you that advocacy isn't just something for politicians or policy experts. It's something we can all do, in big and small ways, to make real change. Advocacy has been my vaccine against burnout, and it's my passion to help others harness their advocate voice for meaningful change.
As emergency medicine professionals, we care for people at some of the most critical moments in their lives. But we also know that health is about more than just medicine. Genetics only account for roughly 25% of a person's health. The rest? It's shaped by the world around them, by policies, systems, and social drivers of health like access to care, safe housing, and fair wages.
And that's where our voices come in. We see the gaps in the system firsthand, and we have the power and the responsibility and honor to push for change. Advocacy can take many forms, and in this mini-series, we'll explore the many ways we can step up, from workplace advocacy to legislative advocacy and beyond. For our first episode, we're diving into a powerful example of workplace advocacy. We'll be having a conversation with Dr. Michelle Wiener, an emergency physician who, along with her colleagues, made history in 2023 as they took on a private equity-backed staffing group, created a union, and fought for better working conditions and patient care. Her experience demonstrates that meaningful healthcare reform doesn't just happen in legislative chambers or corporate boardrooms. It can begin right in our own emergency departments, driven by dedicated healthcare workers advocating for better patient care in their local communities. So whether you're new to advocacy or already involved, I hope this series will leave you inspired and empowered to take action, because the future of emergency medicine is shaped by those who speak up. Let's get started.
Welcome, Michelle. Can you introduce yourself and tell us about how you ended up organizing your colleagues?
Absolutely, and thank you for having me on. I'm very excited to be here. My name is Michelle Wiener. I am clinical faculty and a physician at a large level 1 trauma center in Detroit. When I first kind of got out of residency and signed my contract, I was signing with an independent group at the time. And about 2 weeks before I was about to start my new job, I was informed that the contract would be taken over by Team Health, which is a large private equity group backed by Blackstone. And I was going to be required to sign a new contract before I even started. At the same time, our hospital, which was a private hospital at the time, was also being bought out by a large corporate equity group as well. And so when I started, there were a lot of changes coming through. Initially, they told us that nothing would change. Everything was going to run the same. And over the next 2 years, we started to see a large number of changes, most of which we didn't view as good or positive for our patients or our group. So we started the way most people start, by talking to the head of our department, people in the hospital, trying to advocate for change, having secret kind of off-site meetings, about the things that we wanted to see change. And when that didn't really work, we decided to form a private association to advocate for, better physician treatment, wellness, and patient advocacy. Eventually, over the span of the next several years of having meetings directly with our employer and trying to push for change through Team Health, we ended up forming a union in 2023, which ultimately led to negotiations that lasted over a year, a strike, and the hospital leaving their contract with Team Health and accepting a new group that's a private democratic group that we are now a part of.
So you mentioned that when these private equity-backed groups took over for your hospital and your staffing group, y'all saw not so great changes. What kind of changes did you see?
So initially, even within the first contract, we had less CME. Our healthcare plan wasn't as good. There was no transparency in the billing or profit sharing. There was no 401k matches. And then the staffing was determined by a group that was out of state, that wasn't directly involved with our site.
How did it affect patient care?
A lot of the things that we were dealing with were provided by the hospital. We don't staff the nurses or the transporters or the lab techs. And so a lot of the delays we were seeing, when 6 nurses show up instead of 24, were coming from both sides. And then the problem is our employer would say, well, you guys are seeing less people per hour. And that means we're cutting physician staffing. Meanwhile, we have an 8 to 15 hour wait. And who's directly responsible for that patient care? The physicians. I am. I'm the one that has to tell the patient's families that something bad has happened, or to explain and apologize why somebody that came in with a CAT scan that said they had appendicitis still waited for 7 hours in a waiting room. And so I think the frustration levels just started to rise as we found that we were having more problems and nothing was being done about them.
And I can only imagine that your waiting room just became more and more unsafe.
No, absolutely. And I think that was one of the things that pushed us over from just trying to accept our situation and work harder and work faster and try to compensate for the problems, and then saying, no, we've had enough, something actually has to change here. We had a patient who arrested after being in the waiting room for 12 hours. And as we're trying to assess the situation and realize that he's not breathing, we have a crowd that's starting to form because they also realized that he had been there for 12 hours and they were also frustrated at the care they were getting. And as you started to hear security move in and yell, clear the scene, as people are starting to throw things at us while we're trying to do CPR and we're trying to drag a body behind closed doors into the main part of the ER just to be able to get some peace to figure out what we needed to do next, I think we hit a line where people were not willing to continue that way anymore. I think the moral injury that comes from knowing that you're working as hard as you possibly can and it's still not enough is more than most people can take in their jobs.
Yeah, it sounds incredibly stressful and demoralizing. Clearly, you and your colleagues were unhappy with the workplace conditions. What did you do about it?
So we started, like I said, by going to the head of our department, trying to work with Team Health by communicating through him. This is a process that did not happen overnight. This is something that happened over about a decade. So we kind of went back and forth, and when we didn't see any real changes coming through, we then decided that we needed a way to directly be able to go to our employer, but in some way that protected us as we were doing that. So we formed an association called the Greater Detroit Association of Emergency Physicians, which then later became our union name. And what that allowed us to do was to be protected under union law without actually being a union. Any two people that are involved in what they consider concerted activity to take on labor issues or improve workplace conditions are somewhat protected under union law. And then we use that association to directly go to our employer and say, we think there's a problem. Here's what we think needs to happen, and can we meet about it?
So what kind of protections under union law are you referring to?
Basically, what it allows you to do is protect yourself against some type of retribution. It makes it harder for them to fire somebody that's coming in and saying there's a problem. So it's not 100% a guarantee of protection like the union is, but it's better than nothing. It also allows for, if they say, well, we're decreasing your benefits or other type of compensation, and because we don't have the money for it, it allows us to demand that they open their books and actually prove that that's the case.
So what you're telling me then is like forming an association is a form of collective bargaining for physicians that give us those protections regardless of our decision to become a union or anything like that.
It is. It is. And it makes people feel a lot better about going to their employer and saying, hey, there is a problem, because you're no longer one person or two people that are easily disposed of. You're an entire group that's standing together, which I think has a much more powerful impact.
So, under this National Labor Relations Act, or NLRA, which is often referred to in lingo, the things that this act protects folks who are going under collective bargaining or collective action, it makes sure that administration cannot retaliate against those for the pro-collective action activities. They can't ask employees if they support organizing or support unionizing. You can't threaten any punitive action for collective actions together. You can't promise benefits if employees reject a union or organized effort. The act also prohibits talking about the union or the collective bargaining during work time unless the admin also prohibits all other non-work discussion. And it also prohibits interfering with employee organization to work together to bargain collectively together.
So, Michelle, I think this is really interesting. You are a self-described lifelong Republican. What led you to conclude that unionizing was necessary?
So I always like to joke that, everybody was willing to unionize after the, uber Republican said, okay, guys, this is it. This is the last thing we have to do. And we're at the end. Here we go, and everybody's kind of shrugged their shoulders and said, okay, well, I guess we have tried everything else. Our group is lucky, and I think they were unique. There was not this polarized attitude towards things that you're finding in the greater society today. It didn't matter if you'd been there for 25 years or you had just started and you were in your first year working there. It didn't matter if you were a Democrat or a Republican. I think the one thing physicians can agree on is that we need working conditions that are conducive to taking care of patients and also supporting the physicians that have to take care of the patients. We need a better working environment for everybody all around. And so they were willing to stand up and say, we've had enough. We tried every other avenue that we could possibly think of. And I unfortunately think a lot of employers these days have gone to a system where they're no longer proactively dealing with problems. They're just putting out fires. So we decided we needed to become one of those fires.
Right. Patient safety and physician autonomy are nonpartisan issues. So what steps did your group take to successfully organize and go down that pathway?
So we were already partway there with the association. We had to get over that hump of signing an agreement, and the hardest thing for physicians, putting in money. We hate parting with our money. It's a real problem. We'd already gotten over that. We'd already felt kind of protected in our decision-making process and the fact that people were going to actually stand together. And so the next step was really to start reaching out to lawyers, to start reaching out to different organizations. I think we really felt like we had been in free fall for a long time. And so we had to create a safety net and build it ourselves to create some sort of floor that would support us that we could fight from. And so we reached out to our national organizations. We reached out to many unions. I spent months on the phones with teams of lawyers from the UAW and Teamsters trying to figure out, one, if this was even something that was possible, because nobody was really sure if attending physicians in a residency program who are considered supervisors of residents could unionize. And the other problem was if you're taking on a private equity group, was it even really worth the fight? After going through all of that and trying to decide if we were going to join an established union and actually having quite a few unions reject us because they didn't want to take on the fight, we found some lawyers through our original attorney that helped us form the association, who was actually a corporate attorney who said, I deal with a lot of these disputes, and these guys work for the unions, and they have been fantastic. They actually helped the Women's National Soccer League take on the fight for, equal pay. So if they can make people care about soccer in the U.S., they might be able to help a bunch of physicians, right? They came in from Chicago. We had a big meeting. They, I think, tried to scare us off of doing it and told us all the problems that we were going to face in the beginning. But I think the biggest and most important part of any of this is finding at least 6 or 7 people who really are willing to believe and dedicate a lot of their free time towards making things better. And we made sure we had somebody that represented our PAs and somebody that represented the pediatric docs and the adult docs, because we have this kind of disparate group of people that we're trying to bring together for a common cause. And so once we got that going and realized that we could form our own union, because that was the other issue. Okay, we can't unionize under a union. Can we just make our own union and unionize under ourselves? And the lawyers said, well, we're not really sure, but, the UAW had to start somewhere, right? Sure. We'll try it. We'll jump off the cliff, and that's a problem for our future selves and how we land.
That's incredible. It really sounds like it was a grassroots effort, and the union is truly just a democratic group of folks who decided that you wanted to come together.
Absolutely. It took a lot of Zoom meetings. It took a lot of phone calls to everybody. It took a lot of talking after shifts, kind of in quiet corners, trying to figure out how we were going to do it and what people actually wanted, and trying to work with everybody so that we made sure we built what we thought was actually democratic and fair, and everybody could have a voice in it.
And there was another union that also unionized at a similar time, like an emergency medicine only attending union. And then you guys were like the second one that just came shortly thereafter.
Absolutely. They actually managed to pull off their union vote a month before we did. And we didn't even really know about it until there were newspaper articles on it. And at that point, we had the cards made, we had them signed, we were ready to send the letters and submit them to the National Labor Review Board to have a vote. And so after that time, through actually ASAP and the panel that they held there, we managed to all get together and meet, which has been a huge support system for all of us. Everybody has their emails and contacts, and we'll call and say, how are you guys doing with your bargaining? And they would say, well, what are you guys running into? And it helps because being the first, nobody's really sure the problems you're going to run into initially.
So tell us about some of those problems. What were the biggest challenges that you faced in unionizing?
The main problem we had is the fact that we're one of the first unions to actually form a union and have to run a union. I thought there was going to be a lot more cigar smoking and bourbon drinking and a lot less federal paperwork and lawyer fees, to be totally honest. If somebody had told me that beforehand, I'd have been like, I'm out. It really was a learning process for all of us. We had to get through the initial making of the cards and submitting the cards. And then there are pre-trials to decide if you even are an appropriate unit to be able to unionize. It's not just like, we want to unionize, let's hold a vote. They're going to try to contest your ability to unionize based on the fact that you're supervisors or, a million other reasons that they can come up with. And then you have to get through the vote. We were reasonably certain that everybody at that point was going to vote for it, but there's still that chance. We managed to pull off a unanimous vote, which getting 40 ER doctors to agree on anything is amazing just to start. And then there's always the fact that they can test the ballots during the actual vote as they're reading them, because signatures aren't right. People were afraid that you were going to put all this time and money and effort in, and we're not going to even get to a vote. There's that famous quote by Emerson, when you strike at a king, you must kill him, right? Once you have submitted those cards, there's really no going back. And I think everybody realized that. The time to have a debate over whether we should do it is not when you're voting. It's way before you actually hold a vote like that, because if you don't have a union at the end of all of this, you spend a lot of time and money and you have zero protection and a very pissed off employer.
And typically employers will have union busting techniques during this time when they try to tell folks who are voting about all the reasons why it's bad to have a union. And so oftentimes union organizers will tell folks to be organizing in the dark. Granted, you all had your association already, but did your employer know that you guys were going towards unionization and the cards when you guys were kind of planning that?
We went into the meeting through the association saying that this would be our next step if we can't get anywhere. And their response to that meeting was, well, 3 people filled out a survey and we seem to be at the 50% mark of where you guys are happy, so we must be doing okay.
Fantastic.
Okay, so where do we go from there? And I think that was one of the keys to our actual unionizing, because the association can only go so far. You cannot force your employer to sit across a table from you and actually collectively bargain through an association. And we realized that if we were going to get anywhere, that is apparently what we were going to have to do.
To summarize that typical pathway to the unionization, so you all would do grassroots work and then decide if people are going to vote yes or no. You make the cards, which are essentially the voting cards, are getting people to agree to form the union. Then you have the union election. Then that is adjudicated as to whether or not those were correct. And then if the union forms and is not successfully challenged by the employer, then the union exists.
That is correct. And then because we were actually our own union, then we had to have elections in terms of who was going to be the union president, secretary, how we wanted to be represented, which was mainly put in place by our bylaws that everybody had agreed to.
And who wrote the bylaws?
We did. We can write a primer. It's going to be much easier for anybody that comes after us, because we learned a lot of labor law that we never wanted to know.
So, Michelle, tell me about what key issues you prioritized and how did you kind of come up with that list of issues?
So I think we kind of used other agreements as a template, and then we got everybody together and said, okay, guys, what's really important to you? And when it really comes down to it, we're going to need a negotiating committee. We want everybody to vote on who's on that committee. And we want to know, if we have to give up some of these things, what do you care about? What don't you really care about? A lot of the things were aimed at safe staffing ratios, benefits that a lot of people think that physicians have, but we don't. We don't have vacation time. We just work the same number of shifts in less days. And that's like saying to somebody who's working 9 to 5, yeah, you can take a week off, but you have to work every other weekend until you make up those days. Most people would think that's not actually vacation time. We wanted at least 1 day of sick pay a year, so that if you have to give up a shift because you get ill, you actually get paid for it and you don't have to try to make that up later on or just work it when you're sick. A lot of the things were aimed at the hospital itself and the relationship between team health and the hospital. And we said, we know you can't make some of these things better or make demands of the hospital, but we at least want you to try. We at least need a safe number of nurses showing up on shifts. We cannot run a department of over 100 beds with 6 people. It's not going to work.
How long did you all spend negotiating and then eventually striking?
Apparently, this is a dance that they don't teach emergency physicians to do. I don't tango well. Let's be honest. We have the attention span of a goldfish, and sitting through a 3-hour meeting, fighting over one sentence is not something that I think any of us were prepared for. So after the first 2 months of going back and forth, because that is part of the game of how to delay the meetings and spread them out as far as possible, and only having a few meetings where we could only agree to a bulletin board that was behind the toilet in the break room, and they could censor what was on it to relay information to union members when I have a WhatsApp group. We realized it was going to be a much longer process than we had originally thought. But we got better at playing the game, and I think we started reaching out to our lawyers and other attorneys who all said, listen, this is how this works. You're going to go back and forth over the span of a year or more, and then you're going to have to threaten to strike or actually strike, and then you'll actually sit down and have a real conversation. So being the short attention span impatient people we said, why would we wait over a year and spend another $40,000 to do that when we can just do that now? If we're not going to get anywhere, I don't see why we're doing this.
So many people believe that doctors should not or cannot strike. And in fact, the AMA Code of Ethics actually says doctors should not strike. How do you respond to that?
Initially, our response to that was we weren't willing to strike. We first met with the lawyers and they said, you're going to have to strike. And we said, well, we're never willing to do that. And they laughed and said, please don't tell anybody else that, because you will never get anywhere in this negotiation. Fast forward a year of having to sit through the negotiations and realizing that this was just a game designed to bankrupt us and waste our time. I think people had a very different view on it. We realized that we had come this far and we were fighting for something that was worthwhile. And if this was the next step we needed to take, then that's where we were going. We did it in a safe manner. A lot of people think you're going to be abandoning patients, and that was not the case at all. We gave them a 10 days notice. We actually chose to only strike for 24 hours, which made it easier for them to staff the department with people who were technically considered supervisors. We have people that ran our department or were like the head of our residency program that couldn't be part of the union. So we knew that they would be able to get enough staff to come in and fill those spots. The important thing for us was just so that they realized that we were serious about making these changes and that we needed to draw some public attention to the issues that were going on. But we never abandoned our patients. We always made sure that they were taken care of.
Right. And under law, all hospitals or medical professionals have to give the hospitals 10 days notice in order to be able to appropriately make sure that there's safety for patients.
Correct. It's not illegal to strike. Everybody said to us, well, it's illegal for you to do that. And no, there's nursing strikes all the time. And the way they get around that is they do give them proper notice so that they can staff the department. And we also had contingency plans in case they actually couldn't staff it.
So what did you all do on the day of the strike? What did that look like?
So it was a bit chaotic. There was a power outage the day before the strike, so the signs were not made. So we were debating getting our kids' crayons together and just drawing on some poster board. There was a lot of feelings like we wanted to vomit as we opened the megaphone. And we had organized everybody into shifts that, people that were willing to walk out were on those shifts, because that's the nice thing about being emergency physicians. We can actually shift things around so that people that were not comfortable doing it didn't have to. Because the actual act of walking out is a pretty significant moment and it's pretty scary. And even though 100% you believe in what you're doing, it's still to like walk out of your job is something that none of us would ever conceive of. I mean, I've gone to work before when there are active bomb threats and dogs sniffing around and they tell me I can't enter the building. I've been there during floods where I literally went in waist deep water to the hospital, so having to physically get up and walk out was a lot. But we got everybody together. We had already done a lot of work with the press and a communications manager, and we walked out.
And how did patients respond to the strike?
So I think it was interesting because we had done a lot of work with our communications people the week before. When you give that 10 days notice, we were on the news, we were talking about it and what it would mean. We tried to prepare the public, though, as much as we could, saying, like, it's still safe to come here. If you're having an emergency, like somebody will be here to take care of you. But it was actually funny. We had a huge outpouring of support from the public, which we were pretty surprised by. I mean, during the strike, we had a woman drive up and hand us 5 boxes of pizza just randomly at 10 o'clock at night. We had like Senator Hertel came out and, Congressman Danadar came out and to help support us. We actually had one guy that was being pulled in an ambulance. And as they're pushing him into the hospital, he realized what was going on. And he said, no, wait, if you guys are all out here, who's in there? And we said, oh, no, don't worry, sir. There's physicians to take care of you. And he goes, I don't want no scab taking care of me. And he literally got off the stretcher and came and ate some pizza with us and grabbed a sign,
So you guys took that step. You went on strike. How did that impact negotiations and the broader emergency medicine community?
So I think it actually had a positive impact on negotiations. We had an in-person meeting after the strike where I think we actually made some real headway. We were very close to getting to a collective bargaining agreement. And I think it was important, in the larger community for people to realize that, one, this is possible, and two, this is really what's going on. So many people have said to me, why are you guys doing this? It's bad everywhere. Like, what's different with you? And my response to that is, it's because it's bad everywhere, and somehow we think that makes it better. Like, we're more willing to accept it because there's nowhere else to go that doesn't suck. How is that an acceptable response to our situation? Something needs to change here. And if we're the first ones to go out there with a megaphone and say it out loud, then awesome. Like, I'm willing to do that.
You were pretty close to your collective bargaining agreement. And then what happened next?
After we went through the in-person negotiations, we got an email and text message that said, we need to have a meeting with team health leadership at 3 p.m. today for the whole group. And we counted the days and we said, well, that is 90 days from when their contract is going to expire. So nothing good can come of this. And we got on the Zoom meeting. It was about 3 minutes. They said the hospital has decided that we are no longer holding the contract. We don't know who is holding the contract. Good luck and Godspeed.
Wow. That must have put you in limbo.
We felt like the entire thing had been blown up. But we had kind of prepared for that eventuality. We had to go through then the next process of figuring out who was taking the contract and what that would mean for the union. So when we talked to the lawyers, we knew we had some succession rights under the National Labor Relations Act. However, in order for the union to stay intact, they had to hire 50% plus one of us. And so there was a real fear among the physicians that what if they tried to get rid of the union by getting rid of half of us?
So then did you guys form your own group?
So what happened is we were actually, thankfully, taken over by an independent Democratic group, which you don't see very often anymore, which is great. And so they have a partnership tract where at that point you would become a supervisor. You do have the ability to vote on things within the group. And we kind of quickly realized that if we are still a small minority of people trying to subvert the majority by demanding extra things through a union, that's where democracy essentially fails. And so it took a lot of faith to try to work with our new employer, but they were great coming in. They managed to offer us a contract which essentially held everything that Team Health didn't have and that we were fighting for in the first place. So essentially what happened next was we had to hold a vote to determine whether or not we wanted to demand collective bargaining from the new group. If we had decided to demand collective bargaining through the union, then that's when the negotiations would have started, and they could have tried to contest our ability to be a union at that point as well, the same way Team Health did, and we'd have to go back through essentially the hearings that we went through in the first place.
And so ultimately, you all voted to do what?
to not demand the collective bargaining. So right now we are essentially in an active union. We could officially vote to decertify the union and not represent ourselves if it comes to that. But there are some, pending issues that we had with team health and things that we settled before they left that would have to be finished before we could even do that.
So it really sounds like unionization was used as a tool to get you all to a good contract, which is what you wanted at the end of the day.
Exactly. I mean, nobody went into this thinking we want to be part of a union. Everybody went into this thinking we want better working conditions. We want better treatment of our patients. We want the resources we need to do our jobs effectively. And whatever we have to do to get that is where we're headed. And so in the end, I think it was a good outcome for us.
So what do you say, Michelle, to physicians who worry that unionizing is too radical or that it won't work?
I say that, yes, it is radical, but it does work. And so this might not be a final solution. This is not what I think we need to do to save all of healthcare is all join unions. But I think we are doing what we do best as emergency physicians. I don't provide definitive care to somebody who's bleeding out in my ER. I stop the hemorrhage, right? And that's what this did. It gave us a floor. When 70% of us or more are employed by corporations and they realize they control the market and they can do whatever they want and they can set the standards and they can set our pay and we really don't have a say in it anymore. How do you start pushing back? How do you create a standard to say, no, this is not okay? And I hope that what we did will make hospitals or private equity groups think twice when they go into negotiations. Can we maybe just work out a few things to improve our conditions without having to do all of this?
So what advice do you have for emergency physicians who want to improve their workplace?
So I think the first thing, and this is why I love your podcast, is advocacy. Honestly, start reaching out. There's a million different avenues that you can take. And I think education is the biggest thing that we need to start doing. Since we've gone through all of this, I've had a lot of people reach out to me from different groups that they're trying to build their own networks. The Michigan College of Emergency Physicians has a leadership development program. I know a lot of other states have this as well. AAEM has avenues you can go to try to join committees and to advocate, on a national scale or just a state scale. Join any medical state society where you get involved in doing some of these things. You're going to meet a lot of people who are doing good work that have different ideas. And I think teaching our residents and our medical students is going to be really key to also fixing some of the problems we have in healthcare. I was amazed. I do interviews for people trying to join our residency. And when I ask them what the biggest problem in healthcare is, the great majority of medical students answer that it's the internet because Dr. Google is ruining healthcare. I mean, this is not even close to the biggest problem in our specialty and in healthcare today. We can't get paid by insurance companies. We can't get paid by the government. We have boarding crisis. We have violence in the emergency department. We are being taken over by private equity groups who seek to make us look profitable and sell us. But they don't know any of these things coming out because you're trained to not kill people. You're trained on how to help your patients. And that's it. The business side, the political side, we don't have a lot of experience and we need to change that.
So, Michelle, where do things go from here? What do you see as the future of physician workplace advocacy?
On a national scale, we all need to start taking the first steps to make our situation better. I think it's interesting how we have just accepted that private equity is an inevitability, that we need them to fight for us with the insurance companies and with the government, because if we don't have something bigger, we're never going to make it as an independent group. I feel like in healthcare, we do all the billing, we take on all the liability, we see all the patients, we generate all the revenue. And then we give all of this to a separate group that then determines what they're going to give us back and promises us they'll protect us against the insurance agencies and the government. We can do that on our own. We can take that money that we would normally give them and we can give it to our national organizations. We can give it to lawyers. We can give it to advocacy groups that we form to fight for ourselves on that platform. I think we need to start standing up for ourselves.
And education is definitely that first step. And we've been sounding alarms in our national orgs, right? The American Medical Association and ACEP actually have released white papers about collective bargaining, about unionization, and what that could look like for physicians. So encourage folks, if you're interested in learning more about it, those are at least definitely like the first place you can take a look. you're my first advocate I'm having on this advocacy podcast series. Do you have any advice for physicians who don't know where to start in advocacy?
They can call me. You can put my cell phone number on here. I am happy to talk to everybody and anybody about the first steps and how to get involved, because I had really important mentors and people that did that for me. I think that it's really important just to reach out to inspire other people to explore unionization, explore their options from people that have done it.
Michelle, thank you so much for being with us today. Your whole story is really inspiring and exciting, and I think it gives us a lot to think about. I think this is going to be a really exciting series. So subscribe and keep listening for more in-depth advocacy discussions with Dr. Anna Yap. And add your voice to the conversation. We are on social media as eImpulse Podcast, and we're now on Blue Sky. Thank you to our department for helping us advocate for our patients and our team. And thanks to OM Productions for getting our voice out there. Until next time, stay curious, stay inspired, and stay tuned.